You're probably thinking, does this girl ever get tired of talking about charting? And the answer is no. So, for newer nurses in long term care, while you are orientating, make sure that you're asking what your facility protocols are on for charting, nurses' notes for specific things, and incident reports, right? So, I was thinking of a few that we could talk about, and then hopefully people with long-term care experience will comment below some that I may have forgotten. So antibiotics is one, right? Where does, nurses notes, right? What antibiotic are they taking? Why are they taking it? How long? Do they have side effects, right? You want to ask your facility nurse leadership what you should be charting and for how long, right? I know back in the day, and maybe it's the same, we would chart the course of the antibiotics plus 3 days after, but that may have changed, and that's why you're going to ask your facility. Let's see, medication changes. So specific medications, you should be documenting if the patient's tolerating it, what they're on, why. A good example of that is any kind of psych meds. Are they tolerating it? Are they exhibiting signs and symptoms? Are they lethargic? Again, you're going to ask your nurse leadership what and how long, what, where, and how, right? And how long. Changing condition is another one, right? What are we monitoring, right? Where do we document it? How long? You want to make sure that you're aware of that, because any change of condition should definitely be documented, monitored. Yeah. Falls, okay? Witness, unwitnessed falls. Nurses know how long. Where does the incident report go? Neuro checks. Is it a paper form? How long do I do it? All of those things. You want to make sure that you are aware and asking questions about that. Allegations of abuse is another great one, right? Where are we charting that? Incident reports, nurses' notes, how long? Who do I notify? You want to make sure that you're at least familiarize yourself with some of these things, because they're absolutely going to come up. And honestly, you may not remember to ask, or you may not even know what to ask. And so a lot of times when these things happen, you want to make sure that you lean on your nurse leadership, your charge nurses, things like that, nurses with a little bit more experience to kind of help guide you, but make sure that you are documenting and you're doing your incident reports.